Welcome to another deep dive from Book Podcaster. Okay, let's face it, when we talk about mental wellness, sometimes it feels like the solutions are kind of stuck on repeat,
hmm
Like the same old advice just keeps coming around.
Totally. And that's exactly why we're taking a bit of a different angle today. We're diving into the world of complementary therapies in psychiatric nursing. Think of it as exploring those extras that can really work alongside the usual treatments to support someone's overall well-being.
Exactly. Looking at the holistic side of things, practices that team up with traditional medicine. So for anyone listening who's maybe feeling like, the standard stuff isn't quite the whole picture, this could be really, really interesting. But what exactly are these complementary therapies? Can you break that down a bit?
Yeah, absolutely. So, in a nutshell, they're non-mainstream practices, but they're used with conventional medical treatments, things like medication, talk therapy. The key thing really is they look at the whole person, mind, body, spirit, not just, a list of symptoms.
Okay, so it's broader than just tackling the immediate problem then.
Precisely. And it's becoming much more accepted in psychiatric care as part of a bigger sort of integrated plan. Our source material actually points out that especially for people looking for maybe gentler, more natural ways to support their mental health, these therapies are definitely gaining traction.
Right on. Makes sense. So our mission today is to really unpack these therapies, figure out what they're all about, and see how they fit into that whole mental wellness puzzle.
Absolutely. Let's start by really nailing down that definition again. What are complementary therapies?
Okay, so we have the basic idea, non-traditional methods, working with the usual stuff, focusing on the whole person. But why is this becoming such a talked about area in psychiatric care now?
Well, like we mentioned, there's this real shift towards seeing treatment as more of a partnership between different approaches. People are actively looking for less invasive, maybe more natural options. And the healthcare field is starting to respond by offering more integrated care.
It's one thing to talk theory, but can you give us a real-life picture? How does this actually play out for someone?
For sure. Think about someone, let's call her Maria. She was on an antidepressant. It was helping, but she was also dealing with some pretty annoying side effects. So, working with her healthcare team, she decided to add mindfulness meditation and acupuncture to her plan.
Okay.
And over several weeks, she noticed a real difference. Like she was sleeping better, her mood felt more stable, she could focus more easily.
Wow, that sounds like a pretty significant improvement. Okay, so complementary therapies, that sounds like a really broad umbrella term. How are they usually grouped together?
Yeah, it is broad. Generally, they fall into about six main categories.
Six. All right, hit me with them. What's the first one?
First up, we have herbal medicine. This is basically using remedies made from plants.
Plant power.
hmm
Okay, so what kind of herbs are we talking about for mental well-being?
Well, you've probably heard of some. St. John's wort, for instance, is sometimes used for a milder depression. Then there's valerian root, often used for sleep problems, and kava kava, which has been used for anxiety.
Kava kava. Yeah, that rings a bell. Is there anything important to keep in mind with these herbal remedies?
Definitely. And this is really important. Just because something's labeled natural doesn't mean it's automatically safe or won't interact with other medications.
Ah, okay.
Yeah, like St. John's wort, it can actually interfere with how some common antidepressants work, the SSRIs. It might make them less effective or worse, potentially cause a dangerous condition called serotonin syndrome.
Whoa.
So yeah, it's absolutely crucial to talk with a healthcare professional before mixing herbs and medications, always.
That is a really, really important heads up. Okay, so category number two.
That would be mind-body interventions. These therapies really zoom in on that incredible connection between our thoughts, our emotions, and our physical health.
Fascinating stuff.
Yeah.
What are some examples here?
Think about practices like medication and mindfulness. They're not just about, spacing out. They can
Yeah.
seriously help reduce anxiety and sharpen focus. Then you have things like yoga and tai chi, great for boosting mood, lowering stress. Plus, they get you moving, improve flexibility,
Yeah.
and even simple breathing exercises. They can be incredibly powerful grounding techniques, especially useful for folks dealing with trauma or anxiety spikes.
That mind-body connection is just so powerful, isn't it? Do you have a real-world example of how this helps?
We do. Take James. He's a combat veteran living with PTSD. He found that incorporating guided imagery and yoga into his routine made a huge difference in managing his flashbacks and that sort of constant physical hyperarousal that often comes with PTSD.
That's really impactful. Okay, moving on. Number three.
Next up are energy therapies. Now, the core idea here is that the human body has subtle energy fields,
Energy fields, okay.
and these therapies aim to manipulate or influence those fields to promote healing.
Right, that might sound a little unconventional to some people. What kind of therapies fall under this?
Examples include things like Reiki, therapeutic touch, and Qigong. Now, it's worth noting, as our source material does, that while we don't have a ton of solid empirical data explaining exactly how these work,
Mm-hmm.
many people who use them report feeling subjectively better, especially when it comes to stress reduction and maybe managing emotions.
So even if the science is still maybe catching up, the personal experience can still be really valuable for some.
Exactly. It really highlights that sometimes the individual experience is a key piece of the puzzle. Okay, moving on to category 4. Expressive therapies.
Ooh, this sounds like it gets the creative juices flowing.
Absolutely. These therapies use creative outlets, art, music, dance, movement as a way to process difficult emotions, trauma, or just general mental distress.
I can totally see how that could be helpful,
Mm,
especially maybe for people who find it hard to talk about their feelings directly.
Precisely. Think about, say, a teenager who's really struggling with social anxiety. Maybe they join a group music therapy session. They might find a way to express themselves and connect with others through the music itself without the pressure of direct conversation.
Yeah.
It can build a sense of community and be a really safe outlet for emotions.
That's a really cool way to connect and process things.
Yeah.
All right, what's category 5?
Number 5 is aromatherapy. This involves using essential oils for their therapeutic benefits.
Ah, the power of smell. We've all experienced that, right? What are some common oils used for mental well-being?
Well, lavender is super popular for anxiety and sleep issues.
Mm-hmm.
Peppermint is often used to kind of boost alertness or focus. Bergamot can be helpful for lifting mood, sometimes used with depression. And you can use them in different ways, diffused into the air, applied topically, always diluted with a carrier oil, that's important, or even incorporated into massage.
Sounds like a pretty pleasant category.
Yeah.
Okay, and the last one, number 6.
Last but definitely not least is nutritional and lifestyle approaches. This looks at how fundamental things like what we eat and how active we are can seriously impact our mental health.
Makes total sense.
Yeah.
We've all felt that afternoon slump after a
Yeah.
junk food lunch, right?
Yeah.
So what are the key areas here?
Well, omega-3 fatty acids, those good fats, they've been linked to improved mood and better brain health. Vitamin D is another big one. Deficiency often correlates with depressive symptoms.
Right.
And there's some really exciting emerging research on probiotics and the gut-brain axis. It's showing this amazing link between our gut health and our mood, even our thinking.
Wow, that gut-brain connection is just fascinating stuff. Any examples of lifestyle changes making a real difference for someone?
Definitely. Think about Emily. She was navigating postpartum depression. By getting some nutritional counseling and making a conscious effort to get out for a daily walk, she saw a really significant improvement in her mood and felt more bonded with her baby.
That's wonderful. Okay, so we've covered the what. What about the who? Specifically, what's the nurse's role when it comes to these complementary therapies in a psychiatric setting?
Yeah, good question. According to the material we looked at, nurses play a really critical role. It's about education, definitely. It's about assessing for safety. Remember those interactions we mentioned.
Yeah.
And also about supporting culturally competent care, respecting where the patient is coming from.
Okay, so what does that look like day to day? What are their specific responsibilities?
Well, it starts with assessment, simply asking clients if they are using any complementary practices. You might be surprised.
Right.
Then it's about education, informing them about potential risks, like those herb-drug interactions we talked about. Super important. Nurses can also make referrals, suggesting certified practitioners or maybe evidence-based programs. And ultimately, it's about advocacy, supporting a client's preference for holistic care as long as it's safe and appropriate for them.
It really sounds like nurses are crucial in kind of bridging that gap between conventional and complementary approaches. Now, you mentioned evidence a few times. Some therapies have research backing them up. Can we dig into that evidence-based practice angle a bit more?
Yeah, absolutely. It's true, not every single complementary therapy has mountains of rigorous scientific studies behind it yet, but many do have growing support. For instance, mindfulness-based stress reduction, MBSR. Loads of studies show it helps reduce symptoms of depression, anxiety, even PTSD.
Okay.
Yoga therapy also has good evidence suggesting it can improve mood and lower cortisol levels, that key stress hormone. And music therapy has shown particular effectiveness, especially with dementia populations and individuals dealing with trauma.
It's really great to hear that research is validating some of these practices.
Mm.
Any examples of this being used effectively in a real clinical setting?
Yeah, there's an example of a psychiatric facility that started integrating short mindfulness exercises into their daily group therapy, and the staff observed that patients seemed more grounded, less agitated. Overall, it really helped foster a more supportive, trauma-informed environment. That kind of practical application is really encouraging to see.
Definitely. Now, are there any downsides or things we need to be cautious about? Limitations, maybe?
Absolutely, that's important too. One key thing is that not all these therapies are regulated or standardized in the same way. So the quality of training and how it's practiced can vary quite a bit. That's
Yeah.
something to be aware of.
Right.
And also, we really need to be mindful of cultural considerations. Someone's cultural background can really influence their openness to or maybe resistance to certain therapies.
So how does that influence care?
Well, it means we always have to consider a person's religious, spiritual, or cultural beliefs as part of their holistic care. The source material really emphasizes providing culturally safe nursing care. That means respecting and, when it's appropriate and helpful, incorporating traditional healing practices that are important to the individual.
Can you give an example of what that might look like,
Yeah.
that kind of culturally sensitive approach?
Sure. Imagine a client from a Native American background. Their care plan might, alongside their standard psychiatric treatment, respectfully include traditional smudging rituals, or perhaps involve consultation with a trusted tribal healer. It's about blending approaches in a way that honors the whole person and their cultural context.
It really sounds like the goal is to look at the whole person, their beliefs, their preferences, and figure out what truly supports their well-being, going beyond just the standard medical toolkit.
Exactly that. Exploring these complementary therapies gives us, and hopefully you listening, a much broader understanding of mental wellness. It shows there are many potential avenues for support beyond just the traditional methods.
It's a lot to take in, for sure. But it's also really fascinating to see all these different options and how they might potentially help someone. It definitely underlines that when it comes to mental well-being, one size absolutely does not fit all.
Couldn't agree more. And while it might seem like a ton of information, perhaps the key takeaway is just knowing that these possibilities exist and understanding the importance of making safe, informed choices in partnership with healthcare providers.
So as you're thinking about everything we've discussed today,
Hmm.
what aspect of these complementary therapies really sparks your curiosity the most? Is there something you heard that makes you think, I might want to learn a bit more about that? It's all about discovering what resonates and what could potentially be another helpful piece in your own or someone else's mental wellness puzzle. You're doing great. Just keep exploring and keep learning.